Osteoarthritis of the ankle is also known as osteoarthritis of the talocrural joint. The ankle joint is located at the joint crease that you can see across the front of the ankle there. It mainly affects the joint surfaces, but also the tissues around the joint, including the capsule and the synovium. And actually often it's those tissues around the joint that cause the pain. Now, in terms of the signs and symptoms, it will often cause pain at the front of the ankle that can refer down a little bit. It will be made worse by walking and impact activity, and sometimes you will get quite a lot of tenderness at the front of the ankle with some associated swelling. Osteoarthritis actually becomes more prevalent as people get older. So we mainly see it in those over the age of 50. And there's two groups that we see this in. The first group that we see a lot of is when people have had trauma to the ankle, so they may have sprained their ankle several times. And as they do that more and more, they actually develop some changes in the joint and they do develop arthritis. So that's one group. The second group is when there hasn't been any clear trauma, incidents or accidents, and actually the pain just comes on gradually. The diagnosis of osteoarthritis is actually quite simple. The gold standard test is an X-ray, but when you come for an assessment, we will also carry out a diagnostic ultrasound scan that gives us a lot of indication, not just about the joint surfaces, but about those tissues around the joint that actually can be the thing that's causing the pain. The treatment of osteoarthritis of the ankle does depend on how severe your arthritis is and how much pain you're in. But for most people, it starts with a course of physiotherapy, and that's going to involve exercises to strengthen the foot, stretch the ankle, and try and restore the full range of movement back at the ankle. We will also look at your footwear, what activities you're carrying out, and also look at your biomechanics. How do you walk? How do you run? That can also help us. Now, if things don't improve or you're unable to achieve the exercises or carry out the exercises during physiotherapy, then there is a role for an ultrasound guided injection. Now, that may be a steroid injection if it's very painful and very inflamed, or it may be something called a hyaluronic acid injection or a PRP injection. Hopefully the injection will reduce your pain, which again means you can then go and engage in a course of physiotherapy to stretch and strengthen the ankle. And if those don't work, then we will be able to refer you off to an orthopedic consultant who will be able to present to you any potential surgical options to get you out of pain and back to what you want to be able to do.